You've made it through spine surgery, but now the real healing begins. From pain management and physical therapy to the post-operative mistakes that can set healing and recovery back, we'll be talking about what it takes to quickly bounce back after spine surgery. And we'll answer your questions on this episode of Ask the Doc, No Appointment Needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, No Appointment Needed, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Javier, who asks, "Hey, Dr. Bru, my bro, Manny is going in for some disc replacement surgery soon. We play soccer on the same team and I need my boy out there. How long does it take normally to recover? How long does it normally take to recover and then get back on the field?" Javier, without personally seeing your boy Manny, it's kind of difficult to answer your question. But in general, disc replacement surgery is surprisingly easy to recover from. In my personal case, I had disc replacement surgery, and it was a 2-level operation. I was basically fully functional within 3 weeks. Within about a month, I was able to horseback ride, hike, and get into the gym. Now, look, it's hard. It's hard to say without knowing many, but disc replacement surgery can be done by with different levels of invasiveness. So, a minimally invasive procedure where the muscle covering called fascia, or the muscle, is spared. In these cases, the abs kind of wake up pretty quick, and within about a week, some patients are already starting to lift gently and start going to the gym. I hope this gives you some optimism with regards to your friend Javier. Our next question comes to us from Prudence, who reached out to us on YouTube page. Prudence asks, "Greetings, Dr. Brusovanik. My mother-in-law, Daphne, has been suffering from scoliosis her whole life and is scheduled for spinal surgery next month. She's a real pistol and always on the move. What's the number one thing she can do to heal faster?" This is a tough question, Prudence, because I have to question, as I would with any patient, whether they really need to have surgery. In general, if you are doing a scoliosis operation, a procedure to correct the scoliosis on somebody who is elderly, you are going to put their life in danger, and there has to be a good reason. Now, the best reason is when scoliosis becomes so severe that they become off balance, meaning that if they just stand up straight, they have to work hard to keep their head on top of their pelvis. And that's both in frontal and sort of side view, sagittal view. So if you see your mother-in-law hunched forwards or being unable to stand up straight, then it's reasonable, after trying some conservative means, to consider a scoliosis procedure. Now, the fact that she's, as you said, a real pistol sort of gives you a good sense of optimism about what's going to happen after surgery, but be aware that the operation is going to be a big hit. She's going to have to really spend some time to get back her energy, to get back her strength. Now, what can she do to heal faster? My advice is avoid the pitfalls, meaning if she stays in bed for too long, she may get a blood clot. So it would be important to get going right away. And if she's taking her time to recover, perhaps a daily aspirin is something to consider. And I would definitely talk to your doc before you do that, just to make sure that you're not doubling up on a medication that will have a deleterious effect on your blood, on your ability to form clots. This is kind of a sensitive balance, so definitely make sure to talk to your doc. As far as diet, with scoliosis surgery, as with any big procedure, patients are going to lose a ton of weight. So it would be a really good idea prior to surgery, if you are, let's say, average to low body weight, to prepare for it with something nutritious, something with high calories. And it doesn't have to be something specific. It doesn't have to be specifically Ensure Shake. It can be anything with high calorie, high protein content. I think it's important to get hydrated. After surgery, she's going to be perhaps not bedridden, but she's going to be having a hard time getting to the kitchen to get drinks, and it's important to stay hydrated. If you notice that she's not going to the bathroom much, as far as urination, then that's a concern, and that may slow down her healing. So make sure she's hydrated. If you feel like she's not eating or drinking enough, consider asking your doc about sending an IV service to her house to give her some hydration. Look, it's hard to really make one's body heal faster. We don't have a lot of means of expediting recovery. We can provide a reasonable milieu and avoid some pitfalls, but other than that, a lot has to do with the surgical technique. I hope this gives you some optimism. Daphne, I hope Daphne has a lot of luck with this operation. Keisha reached out to us on our YouTube page, and her question for me is, hey doc, I'm a collegiate athlete on a scholarship for volleyball. I plan on having a laminectomy performed over the summer to give me time to heal and hopefully not lose my scholarship. Are there any specific foods or supplements that can help with spine surgery recovery? Keisha, that's a great question. I don't want you worrying about your scholarship. Worrying never helped anyone, and I doubt your school will take it away. Secondly, that's a really great question. Look, I don't want to be a bearer of bad news because, again, we don't have much to expedite recovery. There are some pitfalls, and in your case, being an athlete, perhaps your body mass index will matter. I imagine if you are a serious athlete, there is some attention to that, and just be aware that even a small operation like a laminectomy may produce some significant weight loss. The weight will come back. Naturally, it does, but just be aware of those changes, and you will feel a bit weak and perhaps low energy for a few weeks. Now, I'm wondering why you're having a laminectomy. In general, somebody young, I imagine collegiate athlete, somebody in their 20s, the procedure of choice is usually a discectomy. So I would talk to your doc, and the difference is very subtle. A laminectomy is where we sneak in and unroof the spinal canal to create more space. We don't actually go deeper as with a discectomy to address the disc. So I would really talk to your doc before you embark on anything. You want to have all your T's crossed and I's dotted. All right, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. Sabra sent this question via our very own website, allhealthtv.com. Sabra asks, hello, doctor. My husband is scheduled for spinal fusion surgery next month, and I'm a little concerned about something. He can never sit still, and I'm worried about his recovery. What are the biggest mistakes people make after spine surgery? Hi, Sabra. Thank you for your excellent question. So first, to address the issue about being unable to sit still. When a problem is degenerative disc, which is something that is very common, you find that positions that leave you in what's called kyphosis, or sort of forward flexion, they produce more pain. So if you were to sit hunched forward, you put more pressure on that disc. So those who have symptomatic degenerative discs will have a hard time sitting. They will often say, in fact, most of the time, that things like sitting at the dinner table or long car rides are just brutal. Many will try to lean sort of one way, another way, to try to offload their spine, especially if they have pain going down their thighs, down their legs. That could be really problematic. So what you're seeing is a common symptom, and God willing, the operation will help him. Ask your doc, why not a disc replacement though? Because if it's just a degenerative disc with no deformity like scoliosis or spondylolisthesis, then that's really a better option that will afford your husband a lower risk of having to come back and do it again at other levels. Now, what are the biggest mistakes, you ask? The biggest mistakes after surgery are a few, and most are don'ts really instead of do's. So here's a list of the biggest mistakes people make after spine surgery. Sitting still for too long. So you get home, you get into your armoire and into your lazy boy, your sofa, and it's comfortable, and your legs are elevated. That sets you up for a higher risk of developing a blood clot. So the leg may swell, and in some cases, these clots can cause a very serious condition called pulmonary embolism, where the blood clot travels to the lungs, and this becomes a life-threatening emergency. So sitting for too long is a no-go. Try to get up as fast as you can. Now, overdoing it, I let my patients do whatever their pain allows them. Now, you got to talk to your doc, because with some of the more classic operations, we quote unquote had to protect the patients, meaning give them restrictions, so as to afford the best chance of what we did surgically to work. But with modern techniques, patients are really able to get back to normal activity a lot faster. So overdoing it means going beyond what feels comfortable, and I would just generally let patients allow their pain to guide them in what not and what to do. So skipping physical therapy. Now, look, this is very surgeon specific. Some patients, some types of operations require monthly, a lengthy physical therapy regimen. Some procedures, like for example, modern day disc replacements or minimally invasive revisions, really get patients back with minimal physical therapy needs, but you gotta follow the instructions of the surgeon that you have put your trust in. You gotta let them produce the results that they expect to produce with their technique. So I would definitely follow the guidelines of your doc. Now, not getting enough sleep is a big deal, and that's especially hard in the hospital, where someone comes in pretty often throughout the night to check the vital signs and to check on the patient. Otherwise, there are a lot of interruptions. So sleep is important. You may find that your sleep will be interrupted for a long time after your surgery, just by the nature of the chemicals that are used and the trauma that the body incurs, the dissonance between sort of the energy in your head and the energy in your body. So try to get as much sleep as you can, but don't be surprised if your sleep is altered within the first few weeks. So not staying hydrated is a big one. For me, after my operation, I wasn't allowed to eat or drink for a couple of days, and that's a common thing to do to be safe after surgery, to avoid sort of bloating of the belly. And I had to call one of my friends to set up an IV and give me hydration that way. So these services are available widely these days. Consider IV therapy if you are feeling dehydrated. How do you know if you're dehydrated? Your urine will become very dark, and the frequency of urination may decrease significantly. You just don't feel like you have to go. Then you know that you are in need of significant hydration. Now, poor nutrition is a big deal. So a balanced diet is reasonable when you're allowed to resume a balanced diet. And remember, as far as nutrition, most spinal operations will be associated with a significant weight loss after surgery. So be aware of that if you are on the low, moderate to low body mass index. Stopping pain meds too quickly. That's an interesting one. And again, it's very surgeon specific. Many patients, especially in my world, where patients travel to see me for revision surgery, after their surgery fails, they're stuck taking narcotics. So after surgery, you have to give them more time to lower the dose. Narcotics are difficult to stop suddenly. So there are a few issues here. If you've been taking narcotics for a long period of time and you suddenly stop, you may see some element of withdrawal. Now, if that produces negative symptoms, it's important to at least take a smaller dose so as to stop the negative effects. Now, theoretically, you can say, well, it's never too soon to stop narcotics. Fine, but if you're going to be in so much pain, you're going to lay in bed and it's hard to breathe, then it's a disservice. So be reasonable. Most patients who take narcotics after spine surgery that is successful are able to get off narcotics within a week or two. If you are taking narcotics beyond that, you got to go back to your doc and go through the protocol of figuring out why you are still in pain. Okay, next up, we've got another question from allhealthtv.com. You should really check out our site where you get the chance. When you get the chance, it's chock full of great information. Vladimir asks, hello, Dr. Brusovanik. I'm a bodybuilder and in very good shape, except for a herniated disc that needs to be replaced. I want to know how important physical therapy is for someone like me after surgery. Hello, Vladimir. Even guys who are in tip-top shape like you may need physical therapy. But let's be objective. If your procedure is done in a minimally invasive fashion where muscle is spared, you may find that your abs come back to life within 3-4 days. You'll be getting up from the chair faster and you'll regain your agility. So you got to follow the protocol of the doc who is doing your procedure. He or she knows how to produce the best outcome associated with their own hands and their technique. So if your doc says you got to do therapy, then of course follow that advice. In my case, many patients go through physical therapy before surgery, and if they continue to suffer, we fix them. When the fix is reliable and resilient, patients are able to return to normal activity quickly. Their abs wake up, their back wakes up within just a few days, and they feel good. If you don't feel that way, you gotta talk to your doc. The next YouTube question comes to us from Mallory. She asks, hello, Dr. Brusovanik. My boyfriend, Nick, is a pretty stoic guy and puts on a brave face. He had spinal surgery and I see him wincing a lot, too much, in fact, for someone who had spine surgery over a month ago. How can someone tell if something's wrong during recovery? Hi, Mallory. Thanks for reaching out. This is a really good question. So before your operation, you have a conversation with your doc and you ask him or her what you can expect after the operation. I think it's an important conversation to have before surgery. And listen, don't have surgery unless you have all your questions answered, and make sure that after the fact, if more questions arise, you have easy access to your doc. If a surgery is complicated, which often happens, you need to have direct communication with your doctor. You got to make sure that they're not evasive before surgery, because you don't want to deal with that when you are in trouble and now you need them. So that's important to say first. Now, when can you admit that an operation failed? Well, first, if you wake up and you have the same pain you had before surgery, and days go by and it's the same pain, generally, you should see a difference immediately after surgery. But look, let's be objective. With classic operations or some of the procedures in the back of the neck, recovery takes 3 to 6 months. So make sure that this conversation is had before your operation so that you can really see what to expect. If you've got questions, we've got answers. And just in case you missed it the first couple of times, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Derek just sent us another question on YouTube. Derek asks, Dr. Brusovanik, my husband is not the world's greatest sleeper. He's always moving around when he sleeps. Now, this is normally my cross to bear, but I can't imagine it's too good for his back after recently coming back home from spinal surgery. What's the ideal sleeping position after surgery? Derek, that's a great question. Thanks for sharing it with us. So listen, it's very hard to control how you sleep. Once you fall asleep, you will assume whatever position is most comfortable for your body. First. Second, a successful operation should allow your husband to sleep in any position. So even if your operation is done through the back, you should still be able to lay on your back. Last, you may find that sleep disturbance is very common after spine surgery. Again, on a personal note, when I had my operation It was probably a couple of weeks until my sleep normalized. So be aware that he may be abnormal for a while. That's a great question. Our next spine-related question comes to us from Gigi, who reached out via Facebook. Gigi wants to know, hi, Dr. Brusovanik, my son Trip just came home from the hospital after spine surgery. He's going to be on bed rest for a while and seems a little depressed. He stays in his room a lot and doesn't really socialize much. This is a big change from how he was before the surgery. I'd like to know what role mental health plays in a patient's recovery. Hi, Gigi. Such an important question. Thanks for reaching out and taking a proactive role. That's a tough case. Listen, I had a patient come to my office with his parents. The kid was like maybe 16. He had a big scoliosis surgery. I saw the films, the preoperative films, and he should never have had surgery. This kid didn't have pain before, and the operation not only failed in that he shouldn't have had it, it left him with some significant issues, so hardware had to be removed. Can you imagine the depression that this kid must be in? There is going to be a depression in energy. There's going to be a depression in mental health, commonly with many operations, especially significant ones. So I think mental health plays a huge role in recovery. And there's been studies on this. There's a study on catastrophizing when associated with spine surgery that shows much lower outcomes, significant difference. And then there's a study on people who laugh at their pain, just like that. A study about patients who have back pain or any pain, and they have this response where they laugh at their situation, and they have a significantly better recovery. Now, these are tangentially related, but you can see why this would be important for you, Gigi, to hear. I hope this helps. This next question comes to us from Carlton, who asks, Dr. B, I exercise a lot and play a lot of sports, which is why I'm always using heating pads and ice packs for stiff muscles and inflammation. I'm going to be having spinal surgery soon and was wondering if I can use ice and heat during recovery. Carlton, yes, you should definitely consider using ice or heat. Generally, ice is better after surgery to decrease inflammation, but both ice and heat can burn your skin. So don't apply it directly to the skin and don't leave it on for more than like 20 minutes. I get that question a lot. Well, we have a couple more. Simone asks, Dr. Brusovanik, how can family members or caregivers help with recovery after surgery? Oh, I have something intelligent to tell you about that. So loving family members will often gather around the patient and annoy them. And then they get annoyed. And then everybody gets annoyed. And I've seen it firsthand. Caregiver fatigue is a real thing. So be aware that it's not laziness, it's not lack of will that may be forcing your loved one to stay convalescent longer. There is this frustration that I can see building, and I feel like it's important for you to know that. Of course, you want to get them food, water, take care of them, make sure they're comfortable. Just be aware that this person is needing some peace, and don't get frustrated. If you have questions, we've had answers. And here's the following video will remind you how to send them in.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question came to us through YouTube from Stevie. My BMI is 18 and I've had trouble gaining weight for 46 years now. What's the best way to gain weight without having to eat 6,000 calories a day? I'm unable to eat clean and gain weight. I lost 25 pounds earlier this year and I've only gained 13 pounds up until now. Stevie, this is a tricky question. There is some science that comes along with nutrition I think it would be important for you to talk to a nutritionist. In general, it shouldn't just be empty calories. It should be a good mix. And just beware of taking general supplements. But this is a common question that comes up, and just be aware that with spine surgery, you may see a significant weight loss, even if it's done in a minimally invasive fashion. So be prepared for that, and the weight will come back. Your appetite will come back, and you will recover. If a week, two, a month goes by and you're still having the same pain, you got to call your doc and communicate to them. If your legs are swollen, you're not moving around, ask your doc about taking an aspirin or some form of anticoagulation. And in general, please continue sending us your questions. We appreciate them. And until next time, Dr. Brusovanik, All Health TV, no appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,